So the suboccipitals, going from obviously the occipital ridge, base of the skull, and between C1 and C2. And as we discussed in the anatomy portion, the suboccipitals are really the final postural muscles. So really important if there's any postural anomaly going on, like if someone tends to stand with their weight more on one side than the other, or if they have a scoliosis or a tilt in the pelvis, if they have any shoulder dysfunction and one shoulder's hanging lower than the other, all those things, because our eyes want to see level to the horizon. The suboccipitals are going to do that last little adjustment so that the eyes are level to the horizon. And as we also said, the suboccipitals are stress muscles. They activate in stress, in fight or flight, so that the eyes widen and the eyes can dart around and the head can follow the eyes to look for danger. So sometimes I like to slide my fingers up and into the suboccipitals. Notice I'm supporting her head on my hands. Then I slide my fingers and kind of up into those suboccipitals and hold them there. And then now, Miss Jennifer, I'm going to ask you, you can keep your eyes closed, but I'd like you to move your eyeballs around in the sockets. Move it all the way to the right, looking all the way to the right and all the way to the left. And just go back and forth, right and left. And I can feel her suboccipitals changing under my fingers. Can you feel that reflection back here at the base of your skull at all? Nope. And that's totally fine. And then I'd like you to bring your eyeballs back to center and then do a little looking down as low as you can and then looking up as high as you can. And then you can just bring the eyes back to center. Let your eyes kind of sink into the sockets. Let them be really relaxed. Let your whole face and jaw relax. Notice if the tongue is at the roof of the mouth. And if it is, drop your tongue down. Great. And then another way to work with those suboccipitals, sliding the fingers up into the suboccipitals. So in that space between C1, C2, and the base of the skull. And now, Miss Jennifer, I'm going to invite you to nod your head, and you'll feel that tuck kind of puts a little extra pressure in there. Yeah, nodding your head. Great. And you can choose if you tuck your chin way down, it's going to really put pressure in those tissues. Yeah, there you go. And just great breathing, perfect breathing. And you can relax your head. Does that feel good? Kind of push into. And you can always do less if that feels best to you. And then another way I like to work in those suboccipitals, I like to give them lots of space. I'll do some work and then do some nice glides. If your client is stress breathing up high in the body and the breath is up high in the chest, the first step in releasing the suboccipitals really is going to be belly breathing, just like scales, just like psoas, all those things. And begin the releasing of the tension with belly breaths. And so, Miss Jennifer, I'm going to invite you to take a really nice, big, exaggerated breath in your belly. Let your belly get really, really big. pushing it up to the sky. And then as you exhale, your whole body gets heavy and sinks down toward the earth, down into the table. Beautiful. And then now I'm going to invite you to turn your head just a little bit to the right. Little turn of the head right, yep. And then now I can feel that her suboccipitals on the right side have pressed more fully into my fingers, and it's very light on the left. And then you can do a little nod or a little shake of the head no there. You can just play with some different movement, kind of focusing on that right side. Yeah. Wonderful. Does that feel good? Mm-hmm. Great. And then now we're going to go to the left side. You just rotate your head over to the left. It's going to drive the pressure into the suboccipitals on the left side. And then you can go ahead and do some movement if you want to play with some movement. Mm-hmm. Nice. Ooh, one just released. It went bloop. Great. And then coming back to center. Nice. And then soothing. Wonderful. And that is treating the suboccipitals with your client supine.